Weight loss surgery is extremely beneficial and very safe. What makes it safe is that it is an elective procedure. We have plenty of time to prepare for the surgery, do all the necessary testing for our patients, and assess our patients' risks. Second, both myself and my affiliated hospitals, as well as surgical center, have an extensive experience in this surgery. We have performed thousands of procedures. And experience does count. However, complications can still occur. In this video, I'd like to discuss some of the complications which can happen, along with strategies to prevent and to treat them. The first complication I'd like to talk about is allergic reaction. Allergic reaction may occur to any medication or substance given at the hospital or afterwards. It may include minor reactions such as rash, or it can be severe and overwhelming. It is important to report any itching or rash immediately to a nurse or a doctor. This will ensure that the medication that could be causing an allergic reaction can be discontinued promptly. Let's talk about anesthesia complications. Anesthesia is used to put you to sleep for the operation. The anesthesia can be associated with a variety of complications and side effects. Most common, nausea. You will receive several medications before and after the surgery to prevent nausea. Anesthesia may also cause blurred vision for several days after the procedure. You will discuss risks of anesthesia with your anesthesiologist. It is important that you undergo a physical exam with your primary doctor as well as necessary testing before receiving anesthesia. Bleeding. Bleeding can range from a minor bruising at the surgical incision to a severe intra-abdominal bleeding that may require emergency surgery or blood transfusion. You will be carefully monitored for signs of bleeding by performing frequent vital signs checks and blood work. Let's talk about complication of blood clots. Blood clots are also known as deep venous thrombosis. It can lead to another serious complication called pulmonary embolism. Pulmonary embolism is a migration of blood clot from the veins of the leg into the veins of the lungs, which can cause a cutoff in blood circulation and reduce oxygen in the body. You will receive several blood thinners before and after the surgery to prevent this complication, but you also should walk as much as possible soon after the procedure to prevent blood clots. Let's talk about infection. Infection can include wound infections, bladder and urinary tract infection, pneumonia, skin infection, as well as infection of the IV sites, as well as deep abdominal infection. Infections are prevented by giving antibiotics before surgery, as well as performing surgery under strict sterile conditions. Infections should be treated promptly when discovered to maximize the chance of cure. You will need to report any fever immediately. You will be monitored for signs of infection in the hospital. Complication of leak can occur after gastric bypass or gastric sleeve. During the leak, contents of the stomach, such as acid, bacteria, and digestive enzymes, can leak from the stomach into the abdomen and cause abscess and infection. This can require repeated surgery, intensive care, prolonged hospitalization, and may even result in death if not diagnosed timely. Although leaks are exceedingly rare, they may still occur. We do have a comprehensive testing and monitoring process to detect leaks and treat them as soon as possible. You will also receive detailed instructions after the surgery on how to monitor yourself for the signs of leak. Narrowing or stricture. Narrowing or ulceration in the connection between the stomach and the small bowel, as well as within the stomach itself, can occur after weight loss procedures. This usually is treated by endoscopy, but may also require surgery. Dumping syndrome. Complication of dumping syndrome can occur if patient with gastric bypass or gastric sleeve eats too much sugar. Symptoms include cardiovascular problems such as weakness, sweating, nausea, diarrhea, low blood pressure, dizziness, and other reaction. It can resemble an allergic reaction. The sugar intake after gastric bypass and gastric sleeve surgery should be kept to a minimum. You will need to refer to the diet guidelines on this website for more information. Bowel obstruction. Bowel obstruction can be caused by scar tissue in the abdomen, which can result from any surgical intervention. The scar tissue can wrap around the bowel and cause bowel blockage. Bowel blockages are extremely rare after laparoscopic surgery because trauma to the tissues during laparoscopy is much less than from a traditional open surgery. Nevertheless, complications of bowel blockage can occur. Patients are advised to call if they develop nausea, vomiting, and have difficulty moving bowels after weight loss procedure. Let's talk about side effects of medications. All medications have inherent risks of side effects. In some cases, the side effects can be also severe. You can also develop an interaction between the medications you're already receiving and the medications you are prescribed at the hospital. Please report any side effects from a new medication you're receiving as soon as possible. Hernia. Cuts in the abdomen used to perform the surgery can lead to a weakness in the abdominal wall and development of the hernia. You will receive detailed instructions on how to prevent the hernia after surgery. Hair loss. Sometimes patients develop hair loss for a short period of time after weight loss procedure. The hair loss is related to change in hormones after reduction of fat in the body and can also be caused by nutritional problems. You can take special supplements to minimize risk of hair loss. Those supplements are available on our website. I would like to discuss vitamin and mineral deficiency. After weight loss surgery, vitamin and mineral deficiency can be caused by malabsorption of vitamins and minerals. You will need to take vitamins on a regular basis and go for blood work at least twice a year to determine whether your body is getting enough vitamins. You should call our office if you start feeling weak, have memory loss, numbness or tingling in hands or feet, dizziness, or changes in vision. Those could be signs of vitamin and mineral deficiency. We have excellent vitamin supplements available through our website, which can prevent vitamin deficiency and related problems. You also have to follow a strict diet plan after surgery to avoid malnutrition. Please refer to our website for more information regarding important diet recommendations. Complications of pregnancy. Vitamin and mineral deficiency can put newborn babies of gastric bypass and sleeve patients at risk for nutritional problems. No pregnancy should occur for the first year after the operation, and patients should not miss any of their vitamin supplements when they do decide to become pregnant. Pregnancy after weight loss surgery is safe, however, careful monitoring is important, and we have to work with your OBGYN doctor to develop a monitoring schedule for your vitamin and nutrient levels. Placement of adjustable gastric band can also lead to several potential complications. For example, the band can shift on the stomach, causing band slippage. This is a relatively rare complication today, as new models of the band are designed to prevent slippage. If slippage does occur, patients may feel heartburn, abdominal pain, and eating could become difficult. This complication requires surgery to remove the band or to reposition it. Another complication of the band is an ulcer at the band area of the stomach, which is called band erosion. This usually is detected during endoscopy, and the band would have to be removed to treat this problem. The stomach pouch above the band can also stretch, causing loss of portion control. In mild cases, this condition can be corrected by deflating the band, but in severe cases, the band may need to be removed. We perform routine X-rays in the office on all our band patients to monitor their bands. These X-rays, called upper GI studies, can detect problems with the band before they become significant. This video was not meant to scare you away from weight loss surgery. We would like to demonstrate that we are fully aware of potential risks and are working very diligently to prevent them. It is also important to remember that the earlier we find out about a complication, the higher is the chance of successful treatment and full recovery. Therefore, patients should be very familiar with potential side effects of weight loss surgery, as well as potential complications that may occur. They would need to report them to our office as soon as possible. I always welcome patients to contact me with any problems regarding weight loss surgery, their risks and benefits. Thank you.